Today's discussion is about another form of HIV prevention, which is known as Post-Exposure Prophylaxis or PEP. And for my fellow soccer fans, no, it is not Pep Guardiola. PEP means taking certain HIV medication regimens within 72 hours or 3 days after possible HIV exposure to prevent HIV infection. This can be in cases of sexual assault, unprotected sexual intercourse with a stranger or a commercial sex worker, or someone with unknown HIV status. Also in the case of occupational or non-occupational needle stick and shared needles to inject drugs. PEP should only be used in emergency situations. It is not recommended for regular use by people who are frequently exposed to HIV. Once PEP is prescribed, it has to be taken every day for 28 days. Every hour counts. This is because the effectiveness of PEP is highly dependent on adherence and how soon PEP is started. And observational research shows that PEP can reduce the risk of HIV infection by more than 80% if taken correctly and on time. It is important to know that while taking PEP medications, you must continue to use other forms of HIV prevention methods, such as consistent and proper condom use or new syringes and needles while injecting drugs. PEP medication regimens must contain 3 or more antiretroviral drugs. There must be a baseline HIV test at the start of PEP and a follow-up HIV testing and monitoring for drug toxicity. If a newer 4th generation combination HIV antigen and antibody test is used for a follow-up HIV testing, then testing can be concluded at 4 months after HIV exposure. However, if a newer 4th generation test is not available, then HIV follow-up tests can be concluded at 6 months after HIV exposure. So, talk to your healthcare provider today to see if PEP is right for you and what PEP regimen is right for you. Remember, health is wealth. Let's join hands together and end HIV epidemic. Thank you.